Congratulations.
Well, welcome, Vanessa and Kim. I really appreciate us finally all coming together and doing this podcast interview. We've talked on the phone. We really do have some, interesting ways that we know each other. We have some commonalities, we have some differences. But just having you two on the show is just going to be so valuable for my audience because we've all had surgery at Center for Restorative Breast Surgery. We all had Dr. Cabiling, and Vanessa and I both had Dr. Wright as well. And so just welcome to the show. How are you guys doing?
Good.
It's a great day here in Austin.
Good. And Vanessa, you're still recovering, right?
Yeah, I'm exactly a month out today. So I'm having
Awesome.
all of the improvements and, some days are higher, some days are lower, but going in the right trajectory.
Very nice. Very nice. I just would like to ask you guys a few questions and sort of we'll get into more of how our surgeries all went and everything. But Kim, I would love to start with you and ask you to share a little bit about your breast cancer journey with my audience.
Well, I was diagnosed with breast cancer in 2016, and I chose a lumpectomy at that time and really didn't realize how hard the 2 year surveillance would be because, you get every 6 months a mammogram or a contrast MRI. And just mentally, that was really difficult. So at the end of that time period, I decided to get a preventative double mastectomy. So I consider myself a survivor and a previvor because at the time that I chose to do the double, I did not have cancer. But because of all my breast density problems, I couldn't rely on surveillance anymore. So that was a really hard choice for me. So I identify with both groups of people.
Okay, interesting. And Vanessa, you are a previvor as well. I mean, so can you kind of explain to the audience what a previvor is? What does that mean and how did that impact your life?
Sure. It's definitely a newer word, and it was coined by Force, which is Facing Our Own Risk of Cancer Empowered. And so they're a nonprofit that advocates for people who have genetic vulnerabilities or high family history risk for cancers. In my own story and family history, I always had this knowing that I would have breast cancer from around age 25, just based on the women above me in the previous generations. And, by happenstance, I happened to have had a breast change a year after I had my son and found myself with a breast surgeon who did genetic testing. And initially, it just said diet and exercise, but it's really fast what we're doing as far as the research goes. And turns out that what was just diet and exercise 8 years ago now has become a recommendation of preventative mastectomy and breast reconstruction for care, and then also removal of ovaries and fallopian tubes to reduce my personal risk of cancer. And so a previvor is somebody who chooses to reduce their risk, and you can choose it an individualized pathway. No way is right, no way is wrong. It's just up to the individual person. So there's always advanced screening if that's right for the person. And I'm somebody who for 8 years have done the alternating the mammogram with the breast MRI. And then after hearing the updated research, I reevaluated my choices and I shifted from screening to the preventative surgeries. And by the time everything's all said and done, I should have about 5 different surgeries to reduce my risk for cancer.
Okay. All right. Kim, you had mentioned something about dense breast tissue. Can
Yes.
you explain how it is that you found out that you have had dense breast tissue? I did as well, and why that matters.
Well, I was not getting mammograms as often as I should have. When I was 33, I had like a baseline mammogram. And what they said to me was, well, let's just do a baseline because your breasts are, I don't think they called them dense, but basically they're lumpy. So I had that and they said, well, everything's good. And then, in my mind, I'm not, you're busy. It's kind of like I wasn't thinking about getting a mammogram. I was young. So I did have two before my diagnosis, but no one ever said to me, your breasts are dense. You know, you should stay on top of this. No one ever said it. And the only way that I did find out is I got a mastitis breast infection, which at the time I was 48. So it's like, you know, why would I have mastitis? But they sent me to a breast specialist because honestly, it looked a lot like inflammatory breast cancer. I knew just enough about inflammatory breast cancer that when I saw it and felt it, I was like, you know, oh my gosh. And they sent me straight away. Had a The radiologist said you have mastitis, and I really didn't believe him because I just felt like this, why would I have that? So I kept my breast appointment 2 weeks later, and when I got there everything looked normal on my breast. So luckily I had a doctor who said, well, you know, your breasts are dense, so I'm going to see if your insurance company will do a contrast MRI. Had I never had the mastitis, I don't know when I would have got a mammogram. You know, it could have been 2 or 3 more years, and a lot could happen in that time.
Absolutely. Yeah, I mean, it's kind of like luck of the draw of what doctor you have. Sometimes it will tell you certain things like that. I found out that I had dense breast tissue, gosh, maybe like 10 years ago, because I ended up having a lumpectomy, lumpectomies that were benign, but nevertheless, that is around the time that I was told that I had dense breast tissue. Didn't really understand what that meant at the time, but now I do. So I, I started this podcast really to try to shorten the learning curve for breast cancer patients, or now we can even shorten the learning curve for previvors, right? So hearing this story from you, Vanessa, is so important just because I actually have met quite a few other women who are also previvors and took it upon themselves to get a mastectomy. We have a family friend who did it many years ago. And I, of course, was too young to really understand what all of that meant. But starting this podcast and naming it Test Those Breasts, so it is all around the premise of early detection. In your words, why is it that early detection is so important? Why does it matter?
So, for early detection, in my own life experience of being part of a sisterhood and womanhood in my family, where I just feel like so many members have been taken from us early and taken from us despite the science and efforts, early detection means hope for a legacy of a long sisterhood and womanhood in my family.
Okay. And how about you, Kim?
Well, I mean, early detection, the main thing with cancer, I mean, if you're going to have cancer, you want to find it before it's in your lymph nodes. So mine was found at stage 1A. So it had not invaded my lymph nodes. It was very small. And had it not been for that mastitis infection, I don't know how long it would have been before we could find it, because even with a 3D mammogram, it could not see inside my breast. It was just too dense. That's why I ended up getting a preventative mastectomy, because I got a very long, I mean, the size of a small lemon lump that could not be seen on a 3D mammogram. So after that happened to me, and thank God it was benign, but I had to have a biopsy, had to go through all that. But after that happened, I was like, I can't keep these, because I can't trust a 3D mammogram. And as you know, sometimes you have to really argue with your insurance to get a contrast MRI. My doctor had to argue to get the one that diagnosed that. And I thought, I can't just rely on a 3D mammogram. So they have to go.
Yeah, it's interesting because I get a mammogram every single year. And I remember in June of 2021, I got a mammogram, and I always ask to get a diagnostics with an ultrasound, because I know the density of my breast tissue. And so I went and nothing was wrong. Like, they didn't find anything. And literally less than a year later, they found a 5 centimeter tumor with
Wow.
groupings of calcification. So to me, in that 1 year period of time, that tumor whatever. I don't know whether it was there the year before or if it had just developed right around that time and then it grew that fast. I do know that it was aggressive, but holy moly, just waiting a year to get your mammogram and going in there and finding out that you have that big of a tumor. I mean, that's not a small tumor. And it was stage 2. I found out in New Orleans last December when they took the lymph nodes out that it had not made it to the lymph nodes. And so early detection to me is, my gosh, if I would have waited any longer to get that mammogram, it may have made it to my lymph nodes. So I just feel that even though that the treatment that I went through was yuck, and I had to lose my hair, which in retrospect, I guess looking back, I guess is not that big of a deal, but it was a big deal to me at the time. And now I'm pretty open about all the good, the bad, the ugly. But I mean, how sick it made me feel, and just all the things and all the cascading things that come after that. How much worse it would have been had I waited and, into stage 3, into stage 4. And so, and Vanessa, I would like to take this opportunity to tell you how sorry I am that you've lost family members. And I just think that your voice in talking about the previvorship and the importance of women going and recognizing if it's in their family, and even if it's not in their family, to make sure that they go get those, test those breasts, and make sure that you catch it early. Kim, can you talk about your intuition that you had breast cancer before you were even diagnosed?
It was odd because I was fine, and it was like one night I was leaving work and I put my appointment book like this, and I was like, ow. And it started right that fast. I mean, I'd worked all day, I'd been fine, nothing going on, and it was like, ow. So when I got home, I looked at my breast and it was red. So that's kind of what got me started thinking, oh my gosh, I started researching, and I knew just enough to realize those are symptoms of inflammatory breast cancer. So my gynecologist got me in like within, I think, 2 days. And they took one look at my breast and they were like, we're going to send you next door. So that made me feel like, oh my gosh, they're thinking it too. And even the radiologist, after he came in, I had a diagnostic mammogram, came back, had some more. And he came in and told me I had mastitis. I kind of was arguing with him because I'm like, are you sure? And he was like, okay, I know what you're thinking. And if I even thought that, we wouldn't be having a conversation about antibiotics. So he said, you're going to take these antibiotics, keep your appointment with your breast specialist, and antibiotics are not going to clear up cancer. So sure enough, by the time I got there, I mean, I was clear. Everything looked good. But the odd thing is my breast, for better lack of, it started humming at me. And it drove me nuts. It was just like, even with the doctor looking at me saying, well, your mammogram looks fine. I'm like, but my breast is humming. And she kind of looked at me like, it's what? And I'm like, it is vibrating. It's humming. It's driving me crazy. And that's when she said, well, you have dense breast. And do you know that thing hummed? My breast hummed until my lumpectomy.
Wow.
It just was like my body was doing everything it could to go, hey, you got something wrong in here. So I knew. So when I got the call, I really wasn't surprised. And I'll never forget, she said to me, well, your persistence has paid off. You do have cancer. And I just thought, I knew I did.
Yeah, it's interesting. I have quite an intuition myself. I always have a very deep intuition about a lot of things. It's kind of scary actually to think about some of the things that I have known for so long. And the spring before I had my mammogram, it was right before I uh, retired from the school district. I feel like my body was telling me as well that something was going on, because I remember just kind of coming into the finish line of retirement, and I was in the, doing my thing every day, just getting through every day just to get to retirement. And I remember every once in a while, I would feel a zinger, like a burning sensation. And I'd be like, the heck was that? And I'd stop for a minute and then it would go away. I'm like, okay, everything's okay. But it was in my left breast. And I remember feeling a lump. And I always thought to myself, gosh, I always feel lumps, but this one felt different.
Mhm.
And so when I got the ping on my phone right before my retirement party that said, hey, it's time for your mammogram, and I picked up the phone and called and made an appointment to get my mammogram, I couldn't get it for 3 weeks later because at that point it had not been quite a year yet. And so they made it for the 26th of June and said, hey, have you felt anything? Do you notice anything? I'm like, nah. I'm going in for my mammogram. They'll find out if anything's wrong. And so they made it for that date. And I hung up the phone and my husband said, that's not true. You have felt things in your breast and you do have a lump. And I'm like, oh my gosh, I do. You're right. So I picked up the phone and they moved it up by 3 weeks. Because usually if you tell them, yes, I do feel a lump, I do feel something, they will get you in as soon as possible before the year is up. So that intuition does play a really big role. And I know that a lot of women have that intuition. So to my audience, if you're listening to this, and really, really hearing the part about intuition, you need to listen to your intuition without going into hypochondriac mode, and thinking that everything is wrong. But anyway, Vanessa?
Something that I noticed about Kim's story is that she had this inner confidence paired with her intuition that let her speak plainly to her providers to be heard, to advocate for herself. So she moved the mountain herself by her persistence, by her words, by her approach, by her calm, and I think that, some people for myself, it doesn't necessarily come naturally, but through going through this as a patient, you do develop yourself and you are able to more firmly hold that space of, just if I have a symptom, I'm going to report it. If I don't like the provider's answer, I will double check that with a second opinion. Until it sits well with me, I will pursue this and consistently just take care of myself by speaking up. So I love that about Kim's story.
That's a very, very good point. The more I went through my treatment, I got more of a voice. And I had a voice before. I am pretty outspoken and I will ask for what I need. And especially the older I get, and I know it does not come naturally to some people. But when you go through something like this, it is really important to find your voice, and it is important to ask and let your providers know what you're feeling and what you need. And again, to your point, Vanessa, if you are hearing something that does not seem right from your provider, you need to definitely learn how to get a second opinion. It's like walk out that door, go get a second opinion. So good for you too, Kim. Thank you for pointing that out, Vanessa. Kim, you ultimately ended up having deep flap surgery, and that is the same surgery that I had. What was your experience at Center for Restorative Breast Surgery?
Well, I could never say enough good things about my experience there. I just wish everyone could go and get treated that way when they're going through something like we all went through.
Yeah, one of the biggest reasons I ended up going there is because I know that they are super big into holistic healing. And that is exactly the experience that I had. So the nurses there, Kim, what are they like? What was their bedside manner like?
Oh, well, it was just like no other hospital I've ever been to. I mean, it's funny to not want to leave a hospital, but honestly, like I could have stayed there. We actually did the first day. We milked it. We stayed for dinner. My best friend was my caretaker for my second half, and she loved it there. I mean, we're just like, we just can't believe it's made an experience that is not the best as good as it could be.
Yeah, they totally understand. the stuff that people are going through when they have to go and get these surgeries. And I remember the food was amazing, absolutely amazing, and my husband was really impressed, and he calls it a boutique hospital, because they had all the things, all the good snacks, and everyone was super super nice. And I do remember when I woke up from my breast surgery, there was this one nurse in particular, and I don't know whether it's all the nurses or what, but I remember this one in particular who they would come in and empty your drains and everything in the middle of the night. They would take your cute little lace. They even give you a lace bra. I mean, come on, like this, they want to make you feel pretty and everything, but they take the bra off and they would go and she'd say, "Oh my gosh, they look so pretty." And I thought, oh my gosh, that is exactly what I wanted to hear, and it was just so soothing and so nice to hear that. So with your deep flap surgery, Kim, how long did it take you to recover? Did you have any complications? How was your surgeon? Tell us all the things.
I did have one small complication, which was a very small seroma, and luckily my local breast surgeon drained it for me. But I mean, when you read about deep flap, it'll scare you to death. I mean, honestly, it's just like, this is scary. But my experience, so I kind of was preparing myself. Well, and it wasn't easy, but I can tell you the next day, I mean, I was up, I was walking. I was able to move about. The recovery itself, by the time you get to phase 2, you're feeling pretty good, and then it's time to do it again. But, within a year, you feel pretty much back to normal, because some people progress faster. I was, how old was I? I was 50 when I had mine. So I just thought, I don't want to be doing this when I know these implants are not working for me. I'm going to do it now while I'm younger. But the recovery was not easy, but it was not that bad.
Okay. Yeah, that's kind of how I felt. It was no joke. It was definitely a surgery of all surgeries. Being 10 months out now, I'm feeling great. My breasts look good. I told Dr. Cabiling that if I never was able to get phase 2, which is the revision, that I would be okay. I would be okay mentally. I would be okay physically, because he did that good of a job with the first phase. And so but I do get to go in December, which will be the 1-year anniversary of my first phase, and to get the revision, which will be really nice. Yeah. Yeah. So this next question, is making decisions for your own body. For me, the deep flap and any kind of autologous surgery was not available in my area. And I did ask my surgeon here, when I found out I had to have the mastectomy, about it. I wanted to know, because I'd heard it from other people. Like, I didn't hear it from physicians. I didn't hear it from, the people that I would hope to have heard it from. But I found out through 3 different friends. When I asked about it, it was like this. Said she really didn't know anything about it, her only concern was is that there was no care when I came back to Reno. Now, Kim, you just mentioned that your local surgeon did help you with whatever complication you had. And so why is it so important for us to make our own decisions for our own body? And again, also, why is it important for our providers to work with us to make these decisions? Vanessa, do you want to answer that?
I was just going to tack on at the end about sometimes a provider's inexperience, or they don't have an immediate answer, and sometimes they give you a vague answer and it seems like it's a no, like, oh, well, you won't have local care. So as a patient, it could feel or seem like a no, but that's not true. Like, right now in my 1-month post-op period, I have my primary care. I have my nurse navigator from my primary care. They were able to get me set up with wound care, like lickety split. I have physical therapy again from my nurse navigator. So all of these different little points along the way to enhance my recovery I was able to stitch together with the help of my insurance company, with the help of my primary care, and just with just general knowledge of like, oh, do you want a lymphatic massage? That might be extra. Do you want to have a physical therapist who knows about breast surgery recovery? Okay. So I just want to make sure that we point out to patients to listen to our providers and to filter and to just say, hey, does that sit well with me?
Okay. Yeah, no, that's a really good point because at that time I was so much in the, kind of in just this crazed state, like, oh my gosh, I have these decisions to make and I needed that help. I needed to have that kind of shared decision making. And I guess what I did is I just kind of went off, did my own research, figured out how I could get this kind of surgery over having implants. And I always tell people, I think that anybody should be able to make whatever decision they want to make for their own body, whether it be implants or autologous surgery. But so thank you for saying that. I guess we do need to listen and we do need to ask more questions. Maybe if I had called the next day and said, hey, can you sit down and talk to me about what you do know? Or can you direct me in, but some people don't even have, me that's being very outspoken, other people may not think about calling up and having that kind of conversation with their surgeon. So thank you for bringing that up. Vanessa,
Mhm.
so Kim and I met on a Center for Restorative Breast Surgery support group on Facebook and introduced me to you.
Mhm.
And we all ultimately had in common the coding crisis with CMS. And I didn't find out, and I'm going to let you go ahead and share that story. I didn't find out about this coding crisis until after my surgery. And when I did find out, I'm like, what the heck? Oh my God, I got to be involved in this. Can you share with us what the coding crisis was and how we are all involved with that, the advocacy efforts, and why it is important to all breast cancer patients or previvors?
Basically, the take home message from the story is going to be pay attention to coding and billing because what we're about to describe can happen again. And so we just need to stay right on the threshold of making sure that women and men have access to breast reconstruction and mastectomy care. So the coding crisis, basically Blue Cross Blue Shield in the middle of COVID in 2019, they just sent in a little letter to CMS and requested like, oh, there's some redundancies in these two codes, the S codes and the 19364. Can we sunset or can we get rid of the S codes? And so from there, CMS said, okay, sure, we'll put that on the docket. But they said, let's take 2 years to sunset the codes to allow the providers and the insurance companies and all the other filaments of the healthcare process to make sure that they're ready for that kind of change. And what happened was that individual companies jumped ahead. So CMS had said, oh, December 31st of 2024, that's when we're going to sunset these 3 S codes. And they were for natural tissue transfer. So autologous transfer either from the abdomen or from the inner thigh or from the upper bum area, the low back area. And so, Blue Cross Blue Shield of New Jersey, United, and also Cigna jumped the gun and just stopped they just canceled that code. And so that kind of caught me in my own net of when I was in the decision making process because I was a Cigna patient. And so, luckily the surgeon that I was seeing, Dr. Potter in Austin, Texas, Elizabeth Potter, she had been vocal on social media, and I just happened to catch her social media message and said, okay, hey, if anybody has Cigna and they're planning on getting breast reconstruction, please call my office and then we can discuss. And so they increased my appointment time. And prior to seeing that social media post, I was planning on seeing at least 3 different providers and trying to make my best decision based on my own personalized care needs, evidence-based practice. And it was a wallop. I suddenly had no choices. I had no choices with my body. I had a time frame, and I also have so many family members diagnosed with breast cancer. My aunt was also, but my final surviving maternal aunt was also diagnosed with breast cancer during this waiting period. And so I felt like cancer was chasing me and that my insurance company was stopping my clock, right? Like what I could do to protect myself and take care of myself, those choices were taken away from me. And so, luckily, through these different evolutions, lots of patients reached out to Cigna. And in about a month's time, they rolled back and they started covering it again. And United also, it was very brief when they weren't covering the S codes and they rolled it back. And I'm not sure about Blue Cross Blue Shield of New Jersey. I think they probably stayed as not covering the S codes. And even to this day, they don't cover the S codes. They prefer that 19364 code. But the advocates were all kind of drawn in to speak of the patient voice and, send that message to CMS through letter writing and through, blog posts and through sharing their stories on social media and then even speaking at the CMS meeting. And so I was fortunate enough to be the only person who was affected by the coding crisis to speak at CMS and say, hey, I'm trying to get this surgery. My access and options to care have been taken away from me. I wanted to see 3 providers to make my best choice. I wanted to have my surgery sooner. Um, it seems like something so simple, this change in the code, but it changed everything for the patient's ability to get care in their community with the providers they wanted to have. And so thankfully, after that June meeting where all the patients and advocacy groups and other physicians, plastic surgeons presented, the American Society of Plastic Surgeons also presented. I'm trying to think if there was any other big names in that meeting, but they all presented in support of keeping the S codes. And there were no dissenters, I guess, to that concept. And we found out in early September that CMS decided to eliminate the whole plan. And so they're keeping the S codes so that it keeps stability for patients to have access to breast reconstruction that they desire. And so, whether you want to go flat, have the Goldilocks, deep flap, S gap, pat flap, there's all these natural tissue kinds of
I think
flaps and then breast implants. Like we should be able to choose and have that protected by the Women's Health and Cancer Rights Act of 1998. But there was just this weird gray area where the insurance companies would cover it, but they just wouldn't reimburse at a livable rate for the physicians to continue to do it through the insurance system. And so then that was pushing, during the coding crisis, that was pushing providers to then ask people to cash pay much higher than what they were even getting reimbursed for the surgery in the past. So they were asking women to pay $50,000, $33,000 for the surgery. And, I've just recently got my explanation of benefits, and that's in the zone of what the providers are charging for the surgery. And it's a highly skilled surgery. You need to have 2 fellowships, plastic surgery. Like you have to do it at a high volume to have this short anesthesia time and incredible outcomes, because some of the patients are in surgery for 12 hours and, as soon as they come out, like, oh, there's a hematoma right there. Like when I came back to Austin, took my son to the orthodontist appointment, I met a woman at the orthodontist appointment who was her story. She was not even to the post anesthesia unit and her surgeon's telling her, hey, you know how we know how there's a hematoma? One breast is really large and one is not. We're going back to the OR. So after her very lengthy surgery, she went straight back into the OR. So we just need to make sure that the providers are getting the appropriate reimbursement for this highly developed skill and talent. And those people who do high volume microvascular surgery are changing women's lives in an extreme way. And so just advocating and protecting these groups that do this labor intensive. And I feel like from the plastic surgeons who do this work, it's a lifestyle, like they're on call a long time because sometimes they have to go back 12 hours later and help the patient again. And so, they need to be paid in order to have this lifestyle of living close to the hospital so you can get back to the patient fast enough. So that's a little bit about the coding crisis and my personal experience of what happened to my body and my choices and my rights. And I just can't imagine. I mean, I guess there's always waiting in everybody's story, And so that waiting was pretty rocky for me because I just felt like I was withheld or denied care.
Right. And from what I understand too, they were going to keep covering the trans flap. I think was that the old version of the deep flap where it compromises the muscle and it's a longer recovery time, whereas the deep flap is much more modern. It does not compromise the muscle and it's a shorter recovery time. And so I was just very lucky to be able to do that. But I thought to myself, my gosh, if all women are not able to have that option unless they paid 50 grand or more, whatever it is, as it was with my Blue Cross Blue Shield, it was out of network. So I did have to fork out 10 grand, which was, not easy for me, but it was worth it to me. But it would have been so much more and I probably wouldn't have had it. So thank you for sharing that. Kim, what is, and I am so thrilled that I actually started seeing Dr. Potter's social media posts as well, because I just became so much more educated and got onto her lives and her Zooms and things like that, and was able to send letters to CMS and get my friends and family to send letters. And that is the power of the people. So when people say my thoughts and my vote does not matter, that is just not true, because we made it happen. All of us did. So Kim, what is your experience with that?
Um, yeah, I just want to say anyone that has not listened to the CMS meeting live, they should go on that link and listen to it, because for me, when I watched that, it was like watching the Kentucky Derby, the Super Bowl, the World Series all rolled into one event, because so many of us had been following it and working so hard to get the message out. And like when I heard Vanessa speak, it was like, yay, Vanessa and Dr. Potter and all the just so many physicians and advocates, joined on and spoke up. And when you hear that, you're like, wow, everybody that spoke was just, it was so good. So if people haven't watched that, listen to it. They really should take a little time and listen to it, and they'll understand what that crisis was. And, if that had not been reversed, so many women coming up in the next year would have been so devastating for them. And some people that don't even know they're going to need deep flap surgery, or they may have their implants now and it's working for them, but in 4 or 5 years they could have trouble, and then there's no option if they wanted to reconstruct, so I would just encourage everybody to take another listen to that, because it was so
Yeah.
good.
And we can't take it for granted, because even Dr. Potter says, look, this isn't over. Like this could come back. We may have to fight for it again. And, which actually leads me to the next question. And we've kind of really already talked about it, about what drives people to become more involved in advocating for women when it comes to deep flap surgery. And one of the reasons that I think is that when you hear people speak like Vanessa and Dr. Potter and all the others, and having women out there on social media encouraging people to write to CMS, I feel like that is encouragement enough when we are bringing awareness to previvors and breast cancer survivors, about making sure that they are advocating for themselves and understanding what their insurance companies are telling them, or, that they can't do, or, whatever. I feel like that's what drove me to jump in and advocate for other women. Cause I'm thinking to myself, yeah, I was lucky and I kind of, skidded through and got my surgery, but I wouldn't have been able to do that. And that just broke my heart for other women. And I thought, I got to be part of this. So, Vanessa, I know that with you, you knowing Dr. Potter and being connected to her, that drove you obviously to do that. And Dr. Potter she's so passionate about making sure that women get the whatever they need for their own body, what they feel is right for their own body. And she even
Yeah.
I think she even did some surgeries for free. Like, I think that she was doing some surgeries for women
She's
who
a
couldn't
servant
afford it.
leader. She's a servant
Yeah.
leader, basically. Like, she wants to make sure that if there is a woman or a man who needs a mastectomy and who needs breast reconstruction, that they get it. And you can see it in her actions by how many insurances she accepts. She accepts TRICARE, she accepts Medicaid, she accepts Medicare, probably all the major carriers too. It takes so much work for her and for her office to have that many contracts and relationships. And, you know, she has all of this passion to speak up for the underserved. And so that comes through loud and clear. And I don't think
Yeah.
I've ever been more inspired by one person.
Me neither. She has
Yeah.
in her voice, in her eyes, and in
Mhm.
her actions really is what inspired me. So to my audience, if you're not following Dr. Potter, Dr. Elizabeth Potter, she's on Instagram. I think she's on Facebook as well. I follow her on both, and I just absolutely adore her. To the both of you, how has connecting with each other to support each other through our journeys impacted your life?
It's easy for me to say. I don't think I could do it without Kim. Kim slid into my DMs in this early advocacy, and yeah, like as a previvor, sometimes you imagine that you'll be judged by a breast cancer survivor or somebody going through breast cancer, but it's the population, the womanhood or the manhood that really understands what you're actually doing and facing and how difficult these choices are, except you have a little bit more lead time to make the choices. It doesn't make the choices any more easy. They're difficult choices to make. And so, yeah, like Kim is definitely a fabric of my life for sure.
I love that.
Especially as
Well,
she's a major quilter. So, like, she's part of the fabric of my life. Yes.
I love it. Well, when I saw Vanessa on Instagram, it really brought home. I have Cigna also insurance, and I just couldn't imagine like doing all that research, working yourself up because you have to work yourself up to cut your breast off. I mean, it's an amputation. That's what it is. You know, there's nicer ways to say it, but we're cutting our breast off, and it's not a light decision you make. Um, and with me having Cigna insurance, you know, I feel like I need to go back to my recovery because I did all of those surgeries from December 2018 to the end of 2019. So my recovery time from deep flap may have been a little bit longer than others because I had the mastectomy with expanders, then I had a removal, then I had deep flap, and then I had my phase two, like all in that span time. So I think other people might not have had a long as long as I did recovering. That was a lot of my body. But I remember when I started thinking about deep flap, and it was like I felt this urgency to do it. Well, you know, I didn't realize in 2020 is when they started talking about these coding changes. So all I knew was I have to do this now. You know, I followed that intuition. I just felt frantic I have to get them out now because people even said to me, well, you can do it anytime, it's going to be covered. And I was like, no, but something could change. So I have to go now. But, you know, when Vanessa has helped me so much because I needed to find my people who were as upset as I was about these coding changes. And when I saw Vanessa, I was like, oh my gosh, she gets it. I've got to find my people because I'd already called Cigna myself and kind of got not much of an answer. So I was like, Vanessa, what are you doing? Who are you talking to? What are they telling you? Because, you know, that's my insurance, and I don't want other women to be denied the same thing I had.
We just had an earthquake.
Oh,
That's why my face is like, oh, what's going on? Yeah, we just had a couple of earthquakes just now. That was really bizarre. And now I hear the dogs out barking. And that's okay. This can be part of the interview. Yeah. This is like
it's
earth shattering, you
earth
guys.
shattering.
Yeah, it's interesting because when all this came up, the coding crisis, it just opened up a whole nother portal of sisterhood that we all get to be involved in that we never really asked for, right? And so I am so grateful to both of you. I have learned so much from you, Vanessa, as a previvor, and, what your experience is. And Kim, you too. I mean, your experience with your DIEP flap and the surgeries that you've gone through. Vanessa, what is the expected recovery period for you? How many weeks out are you now?
So I'm 4 weeks out, so probably about 6 weeks until I go back to work. And, it is just such a major surgery that, there's going to be a new normal for a while. And it looks like maybe February will be my phase 2 surgery. So
Okay.
as soon as I am back and feeling good, then I'll be recovering again. So
Are
thanks,
you
thanks to the
how are you
support of my
feeling?
sister.
Good. Thank you, sister.
Yes.
How are you feeling as far as body image? Do you guys have any body image issues? I thought I was going to have more than I did. At first I did. Before I had the surgery, I was having dark thoughts, but I'm feeling pretty good. How about you two, Vanessa? What are your thoughts on that?
That's what I shared with Dr. Cabling in the appointment was I said, I don't have any impact on my body image. I have incisions, but I feel really great. And
Good.
so, the way the nurses also infuse that, like, oh, you're such a good healer. And wow, like if I had any kind of negative mindset statement, or I would like, oh, it feels firm. And they were like, it's not firm for this phase. So the loving care that was provided, um, really made me ready for what was going to happen in my body. And in fact, I'm improved than where I started. So
Fantastic. How about you, Kim?
Well, after having implants and knowing what they felt like in my body, I can just tell you, there's not a day that I don't wake up and I sleep on my side and I sleep kind of crunched up like that. I couldn't do that with the implants.
Oh.
So every day, almost when I wake up and I'm all crunched up, it's like, oh my gosh, they feel so good. So I think I was able to really accept my body just because it's so much better now. And, if I had some nipples, they would look like, you probably couldn't tell something had happened to me. So eventually I may get some tattoos, but I just look at myself and my scars and I just think, wow, look what I did. Or look what Dr. Cabling did. I didn't do it, but I mean,
Well,
I
Dr. Cabling did it, but you had to go through all the recovery, and that's no joke. And you guys are rock stars in my mind. And I feel like same thing. I don't have nipples, and so I might do the 3D. I'm not sure, but I feel like if I never did, I'd be okay. I did hear it's a game changer, though.
okay.
So maybe. Okay. So did you have something else, Kim?
yeah, this is a little bit funny. Well,
I like funny.
I got some of those. I think they're Amona. I don't know if I'm saying it right. You stick them on, and they're just like silicone nipples. So I thought, well, but they kind of stay on, so it's kind of like you have a little headlight. And so I had them on for a couple days, and I thought, oh, I don't know, maybe I want to get a tattoo, just trying them out. Well, one one morning I woke up and my husband kind of, he was kind of rubbing my leg a little bit, and he goes, "What's this bump on your leg?" I was like, "What do you mean bump?" It was the nipple. It migrated down.
That's awesome. It's like, well, my breasts have just migrated down to
Yeah.
my legs, I guess, right?
So
Oh
I
my
don't wear
God.
them too much anymore, but they lasted a couple days before they migrated. I don't know.
Very good. Yeah, I might have to get some of those just to see what it looks like. So I want to wrap up before I get to the resources that'll be in the show notes. Vanessa, can you offer what is one big piece of advice you would offer to any Previvor out there?
It just, I firmly believe in personalized care. And so, as far as the genetic testing, making sure that you go in and have regular office visits with your genetic counselor because the research updates and changes, and to speak up and ask. They'll have these panel updates on the genetic testing. And so, you want to be an informed consumer and know if your family history matches these new cancers that they're testing. And, poke, 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 request the panel update because they found a variant of unknown significance for me. So 90% of the time that doesn't show up as anything important, but it might be in the future. And then I also have a good friend who's a geneticist, and she had recommended, as we're going through all these different surgeries, better understanding our medication response from a genetic point of view. And so I did cash pay through Invitae, and maybe it was $350, but it let me know that I had a little trouble tolerating narcotics. And so that was helpful. That was helpful going into this surgery. And so just kind of staying state of the art and knowing that it's not a one-time appointment with your geneticist, and that you still advocate for yourself above and beyond. Even when your geneticist says no, like, keep asking. Get to yes.
Awesome. I like that. How can you make it happen for me? Tell me how I can have it happen. Yeah. So Vanessa, are you open to anyone if they have questions? Are they able to reach out to you? I have
Oh, sure.
your contact information, and I'm assuming that you'll be open to that. That's amazing.
Yeah.
Kim, what about you? What is one big piece of advice you have for previvors or breast cancer survivors, or like people who have been diagnosed? Or
Well, I would say number one, do your research. And sometimes I realize when you're diagnosed, you're not expecting that. That's how I was the first time around. So it's like you're just pulled up into a whirlwind and you don't know what to do. But after going through all this, like what you're doing with this podcast, hopefully that's going to make a shortcut for women to know, there is a thing where you can use your own body tissue. And if you are thinking about getting deep flap, you need to make sure you're talking to a microsurgeon when you're asking questions, because sometimes a plastic surgeon is just going to be like, well, that's a really hard surgery and that's what you're going to get. Or they'll say, well, it could be a 14 to 18-hour surgery. It's very risky. And then they go on to the other options. And luckily, my surgeon did tell me every single option. When he mentioned tram flap, I'll never forget this. He said, well, you could do a tram muscles and flip them up. And I went, what? I said, don't you need your stomach muscles? He said, yes, you do. And then he said, if you want to use your own tissue, I don't do that. You need a microsurgeon, but I can refer you to someone. And well, after hearing all that, like my mind is like, I'll just take the implants because they sound easier. And he even said there's all kinds of things that can go wrong with implants. And when I went back to him, because my implants just felt so bad in my body, just I'm talking about my body. I know some people have them and don't have issues, but for my body, they felt so bad and heavy and cold. And I asked him, can we make these smaller? And he said, well, I can make them smaller, but I'm not sure that it would feel better for you. So that's when I decided, I'm having a surgery one way or another. I'm either taking these out. So I'm going to go back and I'm going to look into this deep flap thing, using some of my own tissue. And I had never been on Facebook before, any Facebook groups, but I started researching. And I came across, was just asking questions. Like I see people all the time asking questions. What is deep flap? I live here. Has anyone around this area ever had it? And someone responded to me in the same town, and she had been to New Orleans. And I had seen, weirdly, before I was even thinking about deep flap, I went on vacation in New Orleans and I was riding down St. Charles and I saw the banner, Center for Restorative Breast Surgery. Well, then I'd had my lumpectomy, right? So I'd had a lumpectomy. I was in my 2-year. I just thought, wonder what that is. But when that lady said to me, I went there, like that banner flashed in my mind and I thought, I'm going to call them. And when I called them and did that educational call, I'll never forget, they said, we're going to tell you what questions to ask, whether you come here or not. So I would for sure, if you're considering, know what questions to ask. What's your flap failure rate? Will you convert me to a tram flap? What if my blood vessels aren't right? You need to know all these questions. Otherwise, you're just going to be led and you're not going to know what you should be asking. So just, if you want a deep flap, make sure you're researching with a microsurgeon. Don't ask too many questions of a plastic surgeon because they're not going to do a deep flap.
And I'm assuming you'll be okay if people reach out to you if they have questions as well. And I mean, I have people reaching out to me all the time, asking me questions about it because I'm just such a loudmouth about it now because I couldn't believe that I had never even heard of such a thing,
Right.
you know. And so I just happened to be lucky to find out from these three totally separate people. And they spent about 3 hours on the phone with me talking to me about it and showing me before and after pictures. I had two gals who had implants, went and got explanted. And I know that Center for Restorative Breast Surgery does a lot of those. And it's really interesting because my husband and I had been trying to get to New Orleans for vacation since March of 2020. And so we kept on having to cancel it because of COVID. And I just totally remember we were going, we had the flights and everything, Airbnb, all of it, had to cancel, tried to rebook the next year, had to cancel again because it was such a hotbed there. And then we were supposed to go to an Army reunion there in the following August, had to cancel because of COVID. And what brings me to New Orleans? Breast surgery, right? So we went there a few days prior, and I was able to have a good time in the Garden District. And we did go into the House of Blues and went to the World War II Museum. So we made some fun out of it before I actually had the surgery. And I am now in connection with this gal, Cassandra, who has an Airbnb there, who I have referred people to there. She has a beautiful home in the Garden District, and we're actually staying there again in March. And I have referred people, and she's like, bring them on. She goes, I will accommodate as much as I can. So if anybody is going there and they need a place to stay, reach out to me. I'll give you her number. Well, ladies, I would love to know what resources you have for our audience. Vanessa, do you want to share what you have there?
Sure. So we mentioned Dr. Elizabeth Potter a lot and following her account on Instagram. And then she also started a nonprofit for advocacy called zebraalliance.org. And so I would also recommend following them to stay up to date on all the latest and greatest ways that we can support access to care for breast reconstruction. And then for the previvors, using FORCE, which is Facing Our Own Risk of Cancer Empowered .org, or facingourOwnRisk.org is the website. They offer peer-to-peer support, and so I was able to make access that resource early on, and that helped me not feel so alone and to have somebody else who had been through the journey. And so I was able to make quick decisions after having that human connection of somebody who had that shared experience. And so I would say those are my big resources. And earlier, when we were talking, I would always ask every surgeon you're interviewing, what's your evidence-based practice? And then to be an informed previvor or a person who has breast cancer who has genetic mutations is every 6 months or so the NCCN updates the recommendations, and so you can have the national guidelines. I think it's $15, and just go to the NCCN, and on my case, hereditary breast and ovarian cancer, and you download that, pay $15. So then when you're going to all these appointments, you know the national standards yourself, so you don't have to wonder whether you're being given the best information.
Fantastic. Very valuable information.
Yeah.
Thank you, Vanessa. How about you, Kim?
Well, I would say if you can find a good active local breast cancer group in your area, that is a very good way to learn from other people. I recently just completed a program at the YMCA called the ABC program after breast cancer. That's been a great resource for me. Met a lot of new friends, and also like online on your Facebook groups. One that really helped me was Deep Sea Journey. That I recommend a lot of people to go there because it's has very good solid information, and that the admin there really communicates with people, is happy to help. There's videos, there's surgeon list. There's a lot of really good breast groups, but Deep Sea to me is just a very solid place to go when you need some information. And we all need a shortcut, like you said. Like when you're diagnosed, you don't know what's going on. You need to go somewhere where you can get reliable information.
Yeah, that's really good. I need to get on there because I have not gotten on there before. Deep Sea
Journey. And
Journey.
Terry spoke at the CMS meeting and just, oh my gosh, just I was just like, "Whoa!" That was so, I mean, I just that I was just in awe of all the speakers. Vanessa did such a great job, and I know how much that took out of her to do it, and she just was awesome.
Thank
I
you.
just found it deep sea, and so what I'll do is put the link in the resources as well. That's awesome, and I found a lot of really great information on the NOLA site.
Mhm.
I think that's where you and I connected, Kim, is
Yes.
the NOLA Center for Restorative Breast Surgery, and you can go on there, and if you hear of any, like Dr. Cabling, for example, if you want to see any kind of comment about Dr. Cabling, you go into the group and then you go onto the search and just put cabling on there, and everything that's even been talked about Dr. Cabling or Dr. Wright or whatever surgeons, then, and any kind of issue you want to talk about, you just put it in the search and you should be able to find all kinds of things. So a wealth of knowledge out there.
Mhm.
So, all right. Well, ladies, thank you so much. This has been such a wonderful opportunity to get to know both of your journeys, how you got to Center for Restorative Breast Surgery. Thank you, Vanessa, for your expertise in, the coding crisis that is just so important for people to know about. And then Kim, your experience with your surgery and all the things. You are both amazing women and I appreciate it. And do you have anything further to say before we wrap up?
No, it's just so nice to see you guys in person, and
Yeah.
like you said, we've been communicating so much through texting and talking, and just great to see you guys.
Yeah, it's really great to see you guys too. Hey, you're really pretty, both of you. I love your glasses. We all have glasses on. We are all very, very distinguished. All
We
right,
can't
ladies.
see without them, so we have to wear them.
I
Yeah.
can't see without him either. All right, ladies. Well, thank you very much. And to my audience, thank you so much for joining us on this episode with Vanessa and Kim. And we will see you next time on the next episode of Test Those Breasts.